You guys see it? Okay,
It's blank.
okay, that's fine. Okay,
Okay.
so we're gonna go ahead and take a look at the nephrons, right? You see, here is the Bowman capsule that we discussed, and PCT, and the loop of Henle, and basically you had the DCT and the collecting duct. Now, we also mentioned that afferent arteriole going into the glomerulus, ball of capillaries, and then efferent arteriole, and then pretty much around it would be the peritubular capillary that we discussed. Right now, I'm just going to take out the peritubular capillaries. So just wanted to go over a few things. All right, look, uh, on the abnormality of the urine, if ultimately this part is going to go to the minor, major calyx, and then finally renal pelvis and urinary bladder and comes out from the urethra. So let's say you collected the sample outside when you or the patient is urinating. So now you have the urine, all right? If you analyze this, you might see some abnormalities. For example's presence of RBCs. Presence of the red blood cell in here, all right, is not a good thing, all right. However, I tell you a few reasons for it. Remember, on earlier discussion, we mentioned that the afferent arteriole, you have a lot of different type of blood cells, like white blood cells and red blood cells, and red blood cells and platelets and white blood cells. They were too large to pass, so they were not able to pass the filtration slit, so they end up in the circulation. However, if they are passing, all right, what happens is these red blood cells, they're going to end up in here. Okay. Uh, what causes this red blood cell to be passing? I mean, when you're looking at the filtration slit in here, they're pretty darn small. So when you're looking at the filtration slit, we discussed that last time. All right, take a look right over here. Right, these are the filtration slits and filtration pores and so on. Red blood cells, they're huge compared to here. So how is this coming out of here? Well, several ways. One is that blood pressure could be so high, and that's another problem with high blood pressure, that the pressure obviously in here is going to be so high that is passing through and is rupturing some of these areas, and it's kind of like poking a hole into a filter paper. If you use a filter paper to filter your coffee on a daily basis, if you poke some holes in it, what's going to happen is now the coffee granules is going to end up in your coffee mug, and you're going to have problems. So that's one of the things that can happen, unfortunately. Now, what is the problem with it? Well, the problem with it is you're losing the red blood cells. That's a big problem. Why is it a big problem? Well, because red blood cells, they're supposed to carry oxygen, and when that happens, now your oxygen is not going to be there. Your mitochondria is not going to produce as much ATP. You'll be tired. You'll be sleepy. You'll be pretty much cold. You'll be all those characteristics that the job of the red blood cells do perform. They don't do anymore, simply because you might be anemic, simply because you're losing a lot of red blood cells. You might say, wait a minute, I thought that the EPO is going to make more red blood cells. Yeah, but the rate of the destruction of these really depends on how much red blood cells you carry. If you carry so much red blood cells in your urine that literally what happens is when you're looking at your urine is practically red, that means you're losing a lot of red blood cells, not to the amount that you could justify, and your red bone marrow can make more red blood cells. That can happen, but is probably not going to be to the extent that is losing. So in other words, the rate of the production and rate of the losing it is not rather the same. So that's one of the things that is happening. All right. However, sometimes red blood cells appears in the urine, but it could be from other reasons. All right. Reasons such as collection of the urine. If a person is menstruating, for example, and you collect the urine and there are some samples of the red blood cells in there, that doesn't mean that the red blood cells are passing. That doesn't mean that you have this problem. Another problem is nephritis, like you have the infection, and usually when you have an infection, there is an inflame. So this part is inflamed. Pretend you have a balloon, and the balloon has a small hole in it, like you put maybe some pin or something. You create like with a nail. Let's say the balloon is not inflamed yet. All right, you put the nail, you poke a hole in it, and then you put air in it. That hole becomes so large. All right, okay. So it could be kind of like that too. So um, in other words, when things get inflamed, the pores and everything gets larger, and that allowing substances to pass through. Now, in this case, this is sometimes referred to as erythrocytes or it's referred to as hemoglobin urea, because again, the urine is semi-acidic. So when you red blood cells membrane it breaks down due to the acidic condition, what happens? Then you get a lot of hemoglobin. Hemoglobin urea is the terminology for it. But a lot of times when you get inflammation or high blood pressure and so on, you don't just like see red blood cells, you could see other things such as protein. So if you have protein urea, protein they're not supposed to be passing, but if they are, then again you will see some proteins in here. Uh, just like if you don't want to go to a laboratory, one way to determine if you have high level of protein is just putting the urine into a glass and look at it under the light. If it's very cloudy, say this is your clear glass, if it's very cloudy, that means what? That means there are some proteins in it. So they are bouncing back and it gives you an impression that it's cloudy. Urine is supposed to be transparent. What that means when you're looking at it, yes, it could be yellow, but all the lights can pass through. So that tells you that you don't have much of a protein in it. So again, it's an indirect method. Don't rely on this method all the time, but it's at least is one way that you could do it at home just to see it. In a laboratory cases, we usually analyze the urine for the student, and what it does is we have like a volunteer going and collecting some urine, and then there are some chem stripes. These chem stripes kind of like a pregnancy test and so on. They have like different colors on them, and when you put it inside of this color might change, and then you have to read the label, and it tells you if this color changed to that, you have higher amount of red blood cells than normal or high amount of proteins than normal, etc. But whatever you find in the urine that is abnormal is a big problem. Let's go ahead and take a look at these proteins, for example. All right. Uh, Remember, earlier we discussed about the osmosis. So if you have, here's your red blood cells, I mean red blood vessels, and normally you have a lot of proteins in there. Not a lot, but just normal range, 6 to 8 gram per deciliter. Don't memorize this number, but just like majority of these protein, albumin and such, they are produced by the liver. All right, so liver produce a lot of different type of protein in our blood, and obviously is going to be present in the blood, but they play important role in homeostasis. That what we discussed early on in our lecture, when we beginning when we began the giving you lecture and so on. So remember, when we get to the capillary, the water can go out, but now these amount of protein acts as a solute. Now this causes some of the water to come back, because water always goes to the area with a higher solute. These are capillaries, so they're thin enough, simple squamous epithelial, to allow water to come in. Besides, we have some channels in there as well. So anyways, you don't lose much of the water. But if you lose these proteins through your urine, then we have to erase a whole bunch of them. Now what happens? Now the water doesn't want to come back anymore. So I have to kind of like erase this part. All right. Why not? Because the solute is not high level anymore. The solute is low level now. When the solute is low level, now the water, yes, some of it might come back still, but a lot of the water is going to stay out. This is where you get edema, you get a puffy, hands or legs and things like that. Sometimes you notice like a patient's leg is like really, really puffy. Sometimes it's so puffy that they can't even wear their shoes. All right. A lot of these might be giving you a clue. You do a test. You look at the urine in the under the light, and you notice, wait a minute, it's very cloudy. That gives you, probably you have losing of the protein in there. So what happens now? It could be a result of a liver failure. Your liver may not be able to be producing that much protein. So now you have less protein, or it could be the kidney, you're losing a lot of these proteins because of maybe overlong usage of inflammation, or perhaps maybe an infection of some type. And as a result of that, all these proteins are passing. And if they are passing, ending up in urine, now in the circulation, you have less and less available. So when that happens, you get edema. So you could see, one thing can link to another. All right. Now, having too much protein is also problematic. All right. Now, how could that be? Well, a lot of times, again, when we do get infection, you'll have a higher amount of antibody. Antibody is a protein by white blood cells. If you remember, we discussed this in the blood typing. When you have a lot of antibody for whatever reason, that's protein. Antibodies are protein. So when you have too much of that, again, water will go in. That would cause higher volume. That would cause higher blood pressure and all that stuff. And again, you have moving towards the, homeostasis. Uh, there are other abnormalities, glycosuria, uh, again, a presence of sugar we discuss whenever the person is diabetic or have too much sugar. For example, there is a presence of high amount of glucose in the urine. That could be the case. Ketonuria. Ketonuria is presence of the ketone. This is what happens when you have deprived from carbohydrates. You're breaking a lot of fat. All right. Leukorrhea, presence of the white blood cells in the urine. Leukocytes are for the white blood cells, as you can imagine. All right. So the point is, you don't want to, uh, have different things in the urine that they're not supposed to be there. All right. So we mentioned few of them to keep your eyes open. Uh, I'm just going to stop at this point in time. I thought it was relevant, and I thought maybe you would need a little bit more explanation.